Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Dorenoso, followed by Dr. Henning Ansorg, the county's Public Health Officer. And today, we are pleased to have Chair of the Board of Supervisors, 4th District Supervisor Bob Nelson. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Kim Rich. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Dorenoso.
Good afternoon, and thank you, Gina, for the introduction.
Vaughn, can we have your camera on?
It is. Oh, sorry about that. I'm having technical difficulties. It is on. There we go. Can I get my slides, please? Great, thank you. I'd like to begin my briefing with an update on our vaccination rate. So as of the 23rd, we stand at 87% of the doses ordered administered. And this is because of the delay in us receiving the vaccines due to the storm last week. We fully anticipate being caught up by next week. So of the doses received, we have 83,630. Of that, first doses administered stands at 47,427, and second doses administered stand at 25,624. Next. We are still vaccinating everyone in phase 1A, which is the healthcare workers and long-term care facility residents, 75 plus. And also still eligible are people who are 65 plus years of age. And newly eligible, starting next week, we are going to expand our vaccination efforts to cover emergency services workers, food and agricultural workers, as well as education and childcare workers. Next. With regards to vaccine distribution, we are following state guidelines. So of all the vaccines that we receive from the state, we will be allocating 70% to healthcare workers for those aged 65 and above. We, public health, will keep 30% to conduct community clinics for eligible sectors. And appointments will be made available starting Monday. For clinics on Tuesday and Wednesday, eligible population include food bank, grocery store workers, emergency workers, and we will do special outreach to childcare and everyone else in phase 1A. Priority groups in TK through 12 will be vaccinated next week by our partner, the Lompoc Valley Medical Center. And we are in planning with partners for additional clinics to the sectors. Next. I'd like to just pause and share a little bit more about our efforts to support schools with vaccination and distribution. We have set aside at least 1,000 vaccines dedicated to childcare and education for next week. The first priority, as set by the superintendents, will be teachers and staff working with medically fragile students. We have had many conversations around priority groups, around considerations in order to effectively serve teachers and education staff. We will need to consider that special ed teachers need to be vaccinated in an environment that's after school and on weekends, and that the appointments will be given to Santa Barbara County Office of Education to populate following the agreed upon internal guidelines. And I really want to acknowledge and thank our partners, the Lompoc Valley Medical Center, for being incredible, for being our willing partner in the planning, the quick turnaround time, and the implementation of these vaccination clinics for the teachers and school staff next week. Next. I just want to reiterate to everyone that vaccines are still very limited, even though the following state guidelines, we are expanding. So current weekly vaccine allocations for Santa Barbara, again, 70% will be allocated to those 65 and above, and 30% will be allocated for the educator, childcare, the food and ag, and the emergency services workers. And as you can see, the population in each, we have roughly 32,330 in the age group 75 and above, about 41,000 in the age group 65 and above. And with regards to educators and childcare, we estimate about 23,000 in this sector, and about 33,000 in the food and agricultural sector, and about 6,000 in the emergency services. So we just urge everyone patience as we work through the tiering system, as we work with our partners on bringing vaccines to the eligible groups. Next. So just want to encourage everyone to continue to be vigilant in doing things, doing something effective. And some of those options, some of those tools on keeping our community safe includes vaccination when it's your turn. And remember to continue wearing your mask, watch your distance, please stay 6 feet apart, wash your hands, and please limit your gathering. Limit the number of people, limit the time spent together, and definitely make it outside and with masking and social distance. Thank you for your efforts. I think that we are where we are today because collectively we're all doing a great job adhering to guidance. And I just want to encourage everyone to stay vigilant and continue to do that. And with that, I'd like to hand it over to Dr. Ansord, our County Health Officer.
Thank you, Director Dorenoso. Good afternoon, everyone. We are very glad to see our case rates are dropping and our test positivity is going down simultaneously. This is very good news and allows us to open elementary schools for in-person education and very soon youth sports activities as well. Our percentage of people who have already received the vaccine is steadily increasing, which helps to bring down severe cases who need hospitalization, and it helps to avoid deaths. We are very grateful for these achievements. When trying to anticipate how long it will take for Santa Barbara County to get to less restrictive tiers and therefore open more activities, I would like to explain again what keeps the virus to keep spreading so widely in our community. First and foremost, it is our behavior. 80% of all infections currently are caused by people that are somewhere in the 30 to 60 age range. Usually they are very mobile and through work or socializing, meet with more people. The typically contagious person will actually not yet have any symptoms. They will not feel or look sick. They will feel great. However, the highest virus load that we can measure in the mouth, in the nose, in the throat of somebody who's infected the highest virus number is actually 48 hours before they would develop symptoms. That's when the virus gets spread around. So, studies have shown that speaking loudly, like I'm doing now, that can increase the number of virus particles emitted by the outbreath by 50% compared to normal volume speaking. Just imagine singing. Singing can bring it up to 99%. Now, if you combine this with coming closer to someone's face or ear because of background music or because of celebration mood, then that increases the virus spread significantly. Unfortunately, people who are overweight have a different breathing pattern and therefore also naturally emit more aerosols. It is very interesting that modeling studies have shown that 80% of all virus particles in the air are only emitted by 20% of people. This is for indoor activities. If laughing, speaking loudly, and coming closer to someone's face or ear for any length of time, it will increase the spreading of aerosols dramatically. In short, don't share your breath. Wear a mask and keep a social distance. Now we've learned that most infections, in fact, 80% of all infections, are caused by 10% of people. We call these events super spreader events. If one person in a larger gathering or in a venue spreads the virus to many more people, that's called a super spreader event. And that is what's currently, not just in Santa Barbara, but all over the state, the country, and actually the world, is keeping the pandemic going. So those were all personal factors. There are also some factors that are linked to the venue where the meetings are happening. So for instance, indoor activities are always more risky because depending on the ventilation, the air can get saturated with the aerosols. Restaurants, of course, any crowded place like a bar, of course, indoor exercise facilities, mainly because people are exercising and therefore breathing heavily and emit just much more aerosol into the air. All of these activities should be done outdoors. In summary, the super spreader events, they are keeping the pandemic going. The vaccination is meant to prevent death and severe illness for right now, but it will not stop the pandemic at this point unless we have 90% of people getting vaccinated. So the vaccines are protecting the most vulnerable of us, mainly the elderly, from getting seriously ill. However, at our current level, unless the 13 to 60-year-olds mainly start or continue with social distancing, avoidance of crowds, wearing masks, that's how we can stop the pandemic. Thank you for your cooperation. I now turn it over to the Chair of the County Board of Supervisors, Mr. Bob Nelson.
Thank you, Dr. Anzorg. When I became chair of the board, when asked about our press conferences, I told people I was going to leave that to the experts. But I'm pleased today, as a former high school teacher and coach and father of 3 high school athletes, to be finally talking about something that I might be an expert at. Last March, high school came to a halt, and so did our youth athletics. In July, the CIF, the State Governing Board of High School Sports, delayed the 2021 season till December. State health guidelines prohibited competitive sports for months, even though most states were still active in competitions. Originally, state rules would only allow soccer, baseball, football, and most other sports in our more restrictive tiers. A slow progress that had threatened the subtle hopes of play during the spring. I am very pleased and honored to be here today to share that there's hope on the horizon for sports and our athletes in Santa Barbara County. And this could not come at a better time. We are seeing escalating suicide rates nationwide and a mental health crisis events among our youth. And it is essential to get back to athletics, not only for the physical health, but the mental health of our children and our future leaders. Santa Barbara County is currently in the purple tier with case rate at 16.9, as you heard from Dr. Del Reynoso and Dr. Henning, but our cases are trending down. The new guidance released by the state applies to all organized sports, youth, adults, community, high school, and private organized clubs and leagues. This guidance is aimed at giving communities guidelines on how to safely remain physically active while reducing the transmission of COVID-19 within your community. Specific guidelines are provided for coaches and sports staff, observers, and inter-team competition and tournaments. Excuse me. Test requirements include weekly virus testing for all coaches and athletes 13 and older in close contact sports like football, rugby, and soccer if they are played in counties with a per capita rate above 7. Testing will likely be necessary in Santa Barbara County for weeks to come. Santa Barbara County Public Health has facilitated a way to ensure interim approaches to testing for our schools, as further testing will be needed. My message to school decision makers is to lean on the county as we and the state public health have made careful consideration of the efforts necessary to exercise best practices to get our young women and men back on the field. Due to the risk of transmission that will continue to exist with some sports in particular, teams must provide information to parents on risks, and parents must sign informed consent which acknowledges those risks. Other limitations resulting from this new guidelines include banning indoor activities like team dinners and film study sessions, and prohibits athletes from sharing equipment. Coaches and players not in the game must wear masks, and fans should be limited to only immediate families. The rules will apply to school districts whether or not they have returned to in-person instruction. The guidance I refer to will allow outdoor high contact and moderate contact sport competitions resume in counties, in the red substantial tier and purple widespread tier who have a case rate equal to or less than 14 per 100,000. Santa Barbara County, again, is at 16.9 cases per 100,000. We are not there yet. Again, we are currently at 16.9 cases. We need to get below 14. What can we do about that? First, get tested. The volume of testing in Santa Barbara County matters, and the greater the testing, the greater the adjustment factor to our case rate in an effort to bring down and get below 14. Getting tested also allows public health to quickly identify positive individuals, contact trace, and isolate individuals to prevent further spread of disease and the spikes in the cases like we saw during the holidays. Please remember to be responsible, protecting yourself and your neighbors. Remember, this is not forever, but it's for now. Very simple steps will give our youth athletes back on the field, which is critical for their health and well-being. Our youth have been impacted in so many ways. Let's all commit to work together as one community to give this gift to our athletes. Thank you.
Thank you, Chair, and thank you to Drs. Del Reynoso and Ansorg. So now we're going to go to media. First up is Blake Devine with KYT.
Hey guys, first question for me for Dr. Ansorg. I just wanted to know how our county fared with Super Bowl Sunday. You had said last week that you would probably know the results with how many cases were caused from Super Bowl related gatherings. Do we have that information?
You're on mute.
Can you guys hear me?
Yeah, I heard you well. I was just muted myself. Sorry about
Oh,
that.
okay.
So yeah, now that you reminded me, you're holding me to it. So our case rates did drop, just not as drastically as before. So they are more behaving like a plateau. They went from 28 to 27 to slowly down, and now they're hovering at 17, 16, something like that. Last one I saw was 15.5. That's pretty good. But I would have liked to see them go down faster, which it hasn't happened. So at least we didn't see any blip in the number. That's already reassuring, and it attests to, to our folks behaving well.
Makes sense. I just wanted to clarify a few things. So you guys had said 1,000 vaccines are available for teachers and staff starting next week, and that would be in Lompoc. And will that start on Monday, March 1st? Just wanted to clarify.
No, it will start on Thursday, Friday, and Saturday.
And will that just be available for special ed teachers or any teachers that are working in the district?
Great question, Blake. So the school superintendents have collectively discussed the prioritization of who needs and to get tested first. And so we will follow that guidance and start with the special education teachers. And we hope to move quickly through that priority group to extend to the following priority group as set by the school superintendents.
Makes sense. Can you just speak for a minute just about how important it is to vaccinate some of the teachers that are going to be going back to schools that are reopening, especially at that elementary school level?
I think that vaccination is one of the many tools that we have in order to have school returned safely. So as you know, schools return to in-person learning when they have an approved a school safety plan. And that school safety plan talks about distancing, sanitation, mask wearing, a lot of very detailed environmental control and personal behaviors. And so I think that the ultimate tool would then, of course, be able to vaccinate the school teachers, the K through 6 in person. But again, I think that school, per CDC guidelines and CDPH guidelines, and we support that schools can reopen very safely while we ramp up the vaccination efforts for teachers.
Makes sense. And then according to a press release I saw from the state on March 1st, all the providers and local health jurisdictions will move to a uniform state-directed eligibility criteria for vaccine distribution. Could you guys just explain a little bit about what's going to change starting on Monday with the way that Blue Cross is taking over?
So yes, we actually were on a call this morning, and I believe that while the state hopes that March 1st would be a magical date where we all are following one guidelines and following one appointment system. Unfortunately, that ambitious rollout has not happened, and I don't believe that it will happen until the end of the month by the state's latest guidance and estimation. So at the end of the month, March 31st, the state hopes to have My Turn in place. The state hopes to have the third-party administrator system in place. So when those two are rolled out in all 61 jurisdictions, we will see a uniform tier system and vaccine distribution system.
Makes sense. Thank you, guys.
Thank you, Blake. And next up, we're going to Tom Bolton with Newshawk.
Thank you very much. Good afternoon. I'd like to follow up on one of Blake's questions. Nationally, there are reports that the drop in cases has stalled. And Dr. Ansart spoke a little bit to that, but to what degree are you seeing that locally? And I guess how concerned are you about that? And what do you attribute it to? Is it just the Super Bowl, or are there other factors?
Yeah, I can speak to that, and I'm sure Dr. Dorminoso has also something to say to that. My understanding is this is not a local phenomenon. It's honestly a global phenomenon. So, where I'm from, Germany, they only started to play football now. They only play soccer over there. So there wouldn't be a Super Bowl blip, but the same thing happened there. So after a very rapid decline after this winter surge, all of a sudden we are seeing this plateau at a level where we, from in the peak we had 3,000 people who are infectious. Now we have around 450 who are currently still spreading the virus in the county of Santa Barbara. So in perspective, it looks much, much less, but those 450 are enough to keep it going and smoldering, so to speak, at this level. So that's my not epidemiologically correct answer.
The
Okay.
only thing I would add to that is we are somewhat worried about the plateauing, the slowing down of the decrease in our cases and testing positivity. And it really speaks back to us addressing the pandemic fatigue, us hitting that COVID wall where we are tired. We're tired of all the personal sacrifices that we've made. And so, and there's some sense of just I'm done. I want to see my family. I want to have some parties. I don't want to wear that mask anymore. And so to that, our public health message is really to encourage everyone just to be vigilant a little bit longer until we can get everyone vaccinated, and until we really need to double down, and so that we can move to the next tier and decrease the spread further.
Okay, thank you. There's a line of thinking that it would be more effective in stopping the virus to actually vaccinate younger people who are in high public contact situations rather than the older, more susceptible people. And I'm just wondering if either of you, Dr. Ansorg or Dr. Dorenoso, have an opinion on that.
Yes, Tom, that's a very good question. And that there are countries who are doing that actually. And the answer to the question is we had to make sure that our healthcare system wasn't collapsing, that we had, freezer trucks as morgues in front of hospitals and things like that, which we have seen in New York and in El Paso. So initially we had to just cut the deaths down. We saw this huge spike in deaths, even in Santa Barbara, but in the States, it was 500,000 people died. So the intention when you vaccinate the young and healthy mobile people first is to get the pandemic under control. Ideally, you go into a neighborhood, into individual neighborhoods and so to speak, clean them out, that the virus cannot spread anymore because almost everybody's vaccinated. Now, if you want to avoid death, hospitalization, severe illness, which is, by the way, absolutely horrendous, when somebody's lungs scar over in a matter of days and they die a miserable death. If you want to avoid that, you have to vaccinate the most vulnerable first, the ones that have the highest risk of experiencing these horrific events. And that's what the majority of all countries are doing.
Okay, and so at this stage of the game, I mean, because we're still sort of edging down, by age, to some degree by occupation.
Yeah.
I'm just curious if you think at this stage that it would be more effective to,
it wouldn't
address those other populations.
Yeah, the reason for that is to avoid a death is very hard, even with the best medical treatment. But to avoid a spread of an otherwise healthy person is easy. You wear your mask and you follow our guidance, and that can keep it under wraps, honestly. So I think the choice is the right choice to protect the most vulnerable. That would be the ethical thing to do.
Okay, thank you. The Johnson & Johnson vaccine appears like it will be available fairly soon, and I'm wondering how much impact you expect locally from that.
We are looking forward to a third player in the vaccine landscape. It is very promising. I'm following those reports, obviously, very eagerly. We have a Western States scientific board who is also reviewing it. That's a little bit like the ACIP from the CDC, just for California and the Western Pacific states here. And that'll be very interesting to see the results. We're expecting all of those results on Monday, and that's when the FDA will hopefully issue the emergency use authorization. This vaccine is particularly interesting because it only requires one shot.
Do you have any sense of how much of that vaccine in comparison to the others we're likely to get locally, and in what kind of time frame?
Yes, I only know this from the press, not directly from the state or anything, but apparently they have pre-produced anywhere between 4 to 5 million doses or so. And they are ready to ship them as soon as they get the FDA approval, not approval, but authorization. That could happen Monday. And if that's the case, we will get our share.
Yes,
Okay.
the state mentioned that the state of California anticipates getting 380,000 doses initially next week. And the state will be looking at our demographics, and that will be taken into consideration as part of the allocation methodology. So we're very excited to have, as Dr. Ansorg said, this third option for our county.
Sure, but so to start with, it sounds like it's certainly not on the scale of the other two vaccines that the state's getting.
Right.
However, they're ramping up, and they've promised to have 20 million by the end of March, which is around the corner. And remember, it only requires one dose. So 10,000 doses are 10,000 fully vaccinated people, whereas the other one, you have to cut the doses in half to get somebody vaccinated fully.
Sure. Okay, thank you very much.
Thank you, Tom. And next up, we're going to Laura Place with Santa Maria Times.
My first question is about the county COVID-19 call center. I think in January I had asked to what degree the department was planning to increase staffing in the call center, to better be able to respond to and receive calls from people. And I believe one of the officials had said that staff was going to be doubled, and I was just wondering if there's an update there and if additional staff has been sought out.
Laura, I know that our team up at our call center are continuing to expand our call center capacity to support community members, especially to schedule appointments. I don't have the figures for you, but I shall get that quickly and respond before the press conference is over.
Okay. And my other question is about second appointments for second doses. At this point, should Santa Barbara County residents expect the possibility of having to wait longer than the standard interim period? 3 weeks or 4 weeks for one of the vaccines. Is that an issue right now, or is everyone being scheduled within either that 3 or 4 week period for the most part?
I can speak a little bit to that, but Dr. Dorinoso has the exact numbers. As always, I'm a little bit more. For the most part, when somebody gets their first vaccine, the second one gets planned for. Now we had this 1 week of less supply that threw a wrench in with cold weather and no shipments arriving. That's obviously a problem. And then another problem I see is that sometimes people get their first vaccine outside of county for various reasons. And then it is maybe a little bit harder to get them in for their second one. But it is not unsafe to do the second vaccine, to postpone it to up to 6 weeks. So if somebody doesn't get it at 3 weeks, but at 4 weeks or 5 weeks, that's perfectly acceptable from a medical perspective.
So Laura, I have information about our call center. We are staffed up to the max. We have a total of 12 call takers. We are open 9 to 5, 7 days a week with English and Spanish speaking staff. And we typically answer about 600 calls a day.
Oh, okay. Thank you. All right. And one last question here. 1 second. Okay. Can you clarify which providers are, making second appointments at the time of the first appointment? Because I've heard of some, in some instances, I don't know if this is across the board, but like at Marion Regional Medical Center, some people, are waiting to get a call about their second appointment. So do you know which providers, are scheduling them at the same time and which are waiting?
I don't have that answer, but we typically will be able to help community members who are worried about scheduling their second appointments. I encourage community members who have those worries to call our call center, and our team will be able to assist.
Okay. Well, I do know of one individual this week who was trying for that exact same reason, wasn't hearing back about a second appointment, even though it was reaching up to that 6-week point. They were trying to contact, the county and all that. And since they got that vaccine done at Marion, the county call line wasn't able to help very much. And we're kind of getting into, the trenches of like a specific case, but just to let you know that that individual wasn't able to get much help, through the county line. But
Yeah.
I appreciate the information.
Yeah, sorry to hear that, and I can appreciate the anxieties and the worries when you're up to the 6 weeks and you haven't gotten your appointment scheduled. But offline, Laura, be more than happy to discuss with you that particular case and see what we can do to help.
Okay, thank you very much.
Thank you, Laura. And next up, we're going to the Daily Nexus, Atmika Iyer.
Hi. So my first question is about Blue Shield and My Turn. Dr. Do Reynoso, you said that it's very likely that these two programs are only really going to be coming into place towards the end of March. I was wondering if you could speak to whether or not this delay prolongs vaccinating a good portion of the county, or if the county can sufficiently provide while we're waiting for Blue Shield and My Turn to take over.
So I can 100% assure you that the county's infrastructure and our partners will continue to vaccinate our community. The supply chain, meaning the vaccine allocation from the state to our county, has not decreased, has not faltered. We continue to get vaccines. As a matter of fact, we continue to get increases in our vaccine allocation, and together with our partners, we are continuing business as usual. On the other hand, we are working with the state with regards to My Turn implementation. Our team are getting lessons learned from other counties while we figure out how to navigate that. We are in communications with the state on that rollout. We have a meeting next week with Blue Shield with regards to the third-party administrator and contractual agreements with our county. However, I have heard from my colleagues that, and from the state, reassuring that while we work through the contractual agreements, we will still get vaccines and we can still conduct business as usual with regards to vaccine clinics in our county.
Got it. My second question is that I don't know if this still stands, but once Blue Shield takes over, the idea was that the county would be looking at vaccinating people within the safety net population. I was wondering if the county is planning on doing that as they continue vaccinating residents as well, or if that's something that can only occur after Blue Shield and My Turn take over.
What I am told by the state is that they're happy that the public health, that we have developed partnerships to effectively reach the underserved and the vulnerable populations. And so as long as the county has the capacity, Blue Shield will continue to offer us vaccines in order to meet that population. And everything is in flux. We will again, for example, this week we will offer vaccines to the three tiers, to the three sectors. Meanwhile, we are continuing our efforts outreaching to vulnerable populations and the partners in the community, the service providers, on the effective methods, the effective strategies in not only making sure that vaccines are accessible, but also addressing vaccine hesitancy and worries in these populations as well. So we are juggling all the different balls, all the different oranges, as we navigate with the state.
You definitely touched on my next question about vaccine hesitancy. I was going to ask, a lot of people do have questions about, is one vaccine better than the other, especially when they see various efficacy rates between Pfizer, Moderna, Johnson and Johnson, AstraZeneca. Is there any credence to those fears, or should people get vaccinated with whichever vaccine they can get as soon as they can get it?
Yeah, my recommendation as a physician is get the vaccine that's offered to you because they are all excellent. If we had a flu vaccine that would be 60 or 70% effective, it would be remarkable. So also, the efficacy numbers are trial numbers. So they have to come into the real world, and then they get reassessed. So it's possible that the new Johnson & Johnson vaccine is getting a bad rep that it doesn't deserve. It has many advantages over the other two vaccines. And one of it being, for instance, it has very little side effects, very little, which is great news for people who are very concerned about a side effect, for instance. The other really good news is they have proven in their trials that it prevents an infection. The other vaccines have proven that they prevent a severe infection and death, but this one has even proven that it prevents an infection. So for different scenarios, the different products will be better suited. And so some advantages will outweigh some disadvantages possibly, but I think they're all excellent, and we are thrilled to have a third one so that we can tailor it to the needs of the people who need it the most.
Got it. Thank you so much. My last question is for you, Dr. Ansorg. You mentioned that, just as a clarifying question, that that we should be encouraging 13 to 16-year-olds to mask more. Am I correct in that?
Absolutely, yes. To take
I
it
was
seriously,
I
yes.
was I was wondering if you could provide a little bit of clarity as to why that specific demographic should be encouraged to mask up more.
Just because they are more active socializing. It's also the age group that is either going to school soon or working. So retirees and so forth, for them, it's easier to socially distance because they're not at work where they're exposed to other people all the time. So that's why statewide, it's very clear that 80% of all infections come like that through these super spreader events. And that only happens when people get together.
Thank you so much.
Thank you, Amika. Those are great questions. We've got two more. First up, we're going next to Brooke Holland with Newshawk, to be followed by Fabiola with Two Tiempo Digital.
Hi, thank you so much. For people who are eligible to receive a vaccine and let's say they can't get an appointment right away, what would be your message to them?
I would say that vaccines are coming, but until we get plenty of vaccines where everyone who wants one can get one, just to have patience that your turn will come a lot sooner than later.
All right. And let's say someone doesn't have access to internet. Where would be their go-to place to get information about vaccine eligibility and where to sign up?
They can call 211 and our staff will greatly assist them. We have a proven track record in assisting community members who don't have access to the internet in getting the appointments that they need.
All right. Thank you so much.
Thank you, Brooke. And now we'll go to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, my first question is about farm workers vaccines. We know that this Sunday, 500 vaccines will be administered to farm workers, and we want to know how was the selection made, and our audience also wants to know how can they apply to get an appointment. It's gonna be through the company or directly through the public health department. Can you help us with this?
Um, so I'm sorry, I missed the first part of your question.
Okay.
Fabiola, can you repeat that for me, please?
Yeah. We've heard that this Sunday, 500 vaccines will be administered to farm workers. So we want to know how was the selection made?
Sure. So for that, our clinic on Sunday, it's a pilot. It's a pilot clinic from an equity lens in assuring that farm workers with limited English, with language barriers, with cultural barriers, can have access to a vaccination. We also are calling it a pilot because we want to know the throughput, the logistics of providing a large vaccine clinic to in a bilingual, in a bicultural manner. So we engage various partners in assisting us. We asked a cause. We asked MyCop. We asked our growers and our ag commissioner, as well as our public health staff, to call farm workers and to to help with the registration process. But moving forward, so this was a pilot clinic to assist us in finding the data. Moving forward, we do have set aside additional vaccines for the ag industry, and we will be reaching out to our partners to do the planning with us, and we've gotten offers from growers to do employer-based clinics. We have partnerships with other healthcare providers to do drive-throughs, and we are also planning on mobile clinics. So it's not one size fits all. It's all of these different creative clinics that will allow us to reach the farm workers and the rest of the ag industry.
Okay, thank you. Okay, my next question is about school reopening. I just want to know if you have got any applications from the school district of Santa Maria Bonita, and when do you think Santa Maria County will be able to start in-person classes?
Yeah, it depends on the Santa Maria Unified School District. They hopefully they feel encouraged when they see their sister and brother districts open up. Hopefully they feel encouraged that they can do the same. We are more than happy to help them get their safety plan in order and whatever we can do to make them feel more comfortable in opening. My understanding was that they have so many elementary schools and with a lot of students that they were initially a little bit wary of opening too soon.
Okay, thank you. And my last question is about Moderna vaccine, because our audience is worried. They've heard that Moderna vaccine have been causing more reactions than Pfizer vaccine. Is this true, or what can you tell us about this?
Dr. Ansorg, you're muted.
Sorry about that. So actually the Pfizer vaccine has more allergic reaction than the Moderna vaccine. If that's the limiting factor, or for somebody the reason not to get the vaccine, I strongly recommend to wait for the third one that's coming up, because that
Okay.
has very little side effects.
Okay, thank you. That's all.
Thank you, Fabiola. And that concludes today's press conference. Next Tuesday, the Board of Supervisors agenda includes an extensive update on the pandemic beginning shortly after 9 a.m. You can watch the board meetings live on cable TV channel 20, from the county's YouTube channel at CSB TV 20, and via the county website at countyofsb.org. Fabiola, can you mute your mic? Thank you. Our next press conference is Friday, March 5th at 4:30 p.m. And we have something new. This week, we started a partnership with KUIT KCOY. Each Thursday in the 11 a.m. news broadcast, News Channel's Joe Batista will interview county public health experts to bring you live updates and information. Again, that's Thursday at 11 a.m. as well as the video version of those broadcasts can be seen on News Channel's website. For more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, and more, go to publichealthsbc.org. You can also call 211, select option 4 for information or to be connected to the county's call center. Callers outside of the 805 area code may call toll-free at 800-400-1572. Thank you for your ongoing patience and diligence to slow the spread of the virus in our community. And with that, we wish everyone a safe and healthy weekend, and we will see you next week. Have a good evening, and thank you for joining us.